Thank you for joining us on Health Diary. My name is Gladys Gashanja and we're coming to you from the Garden City residences. There are different types of sickle cell disease, but the most common type in Kenya is sickle cell anemia, a disease that does not get the attention it deserves considering the number of premature deaths and suicide cases associated with it. So today we take time to understand sickle cell anemia and the challenges that sickle cell warriors have to live with. But before we get to it, here now is the fact of the matter. Sickle cell anemia is a genetic disorder in which there are not enough healthy red blood cells to carry adequate oxygen throughout your body. The disorder deforms the normal round red blood cells into sickle-shaped red blood cells. The sickle red blood cells are fragile and prone to rupture. Periodic episodes of pain called crisis are a major symptom of sickle cell anemia, which occur when sickle-shaped red blood cells block blood flow through tiny blood vessels to your chest, abdomen, and joints. Sickle cell is a potentially life-threatening disease and afflicts 1 in every 150 babies born. In Kenya, sickle cell anemia is high in areas prone to malaria, which include the coast, western, and the lake regions. According to a recent study conducted by the World Health Organization and the Masinde Muliro University of Science and Technology, it shows western and coastal regions account for 30 and 20% of all sickle cell cases in the country, respectively.
Huyu mtoto ni Emmanuel Saganda. Ni mtoto wangu, niseme ni watano. Wameaga watoto watatu. Na kwa watatu, mtoto mmoja alikuwa na sickle cell anemia, alikuwa na miaka 4 na huyu mwingine alikuwa stillbirth. Imekuwa safari ngumu sana. Kwa sababu nilipompata, alikuwa mtoto mzuri mwenye afya, hakuwa na matatizo yoyote. Lakini alipofunga miaka 2, ndio akaanza kuonyesha dalili ya kugonjeka kila wakati. Nilimpeleka Roysambu, kuna hospitali inaitwa Medanta Hospital, na hapo ndio alipatikana kuna sickle cell anemia. Kwenda kwa nyumba kuelezea babake, alikasirika. Upendo wake kwa mtoto kaanza kudidimia kabisa. Na daktari alikuwa ametuambia ugonjwa wa sickle cell, mtu anaugua sickle cell hafai kuwa na stress yoyote, anafaa kuonyesha upendo. Alijua tu si wengine wamekufa na hiyo ugonjwa, naye baada amezaliwa nayo, sasa ni kifo tu atakufa. Mother-in-law akamsukuma sana apate mke mwingine mwenye atampatia watoto wazima. Sasa hiyo safari imekuwa ngumu sana. Kama maziwa ya kawaida hafai kutumia, atumia maziwa ya soya, hizo kienyeji, maini, samaki, na dawa pia. Kuna dawa anatumia hydroxyurea, inatoka 2000. Anafaa ikunywe kila siku, lakini sometimes juu ya kukosa pesa inabidi anakaa kama miezi 2 kama haitumii. Unapata saa crisis zinainuka sana. Anaumwa na hizi miguu sana na mikono hadi anaacha kutembea. Hata saa akitembea utaona mguu mmoja umeangalia huku. NHIF imeweza kunisaidia, though inanisaidia upande wa hospitali. Akilazwa natumia NHIF, lakini akienda kliniki, kuna kliniki zao zinaitwa hematology. Hiyo situmii kadi, inabidi utumie cash. Sasa hata shuleni nikimpeleka naambia mwalimu, huyu mtoto usimruhusu acheze sana, juu hafai kucheza sana. Akicheza sana anaanza tena kuumwa na miguu. Watoto ni baraka.
Sickle cell is rarely talked about and largely misunderstood, yet those living with sickle cell with proper management and care, they can live a full and productive life. Now, to understand sickle cell disease with me is Professor Jessie Githanga. She is a hematologist, and just for your information, this is a physician who specializes in the diagnosis, treatment, and prevention of blood disease. Thank you for making time. And Joe Mudukitsa, who is living with sickle cell, and for purposes of this show, I'll call you a sickle cell warrior. Right? Okay, thank you for your time. Now, I'll start with you, Daktari. This is a genetic disorder. How is it diagnosed?
We usually diagnose it first from the clinical history, how the patients present, and from doing a physical examination and then we do laboratory tests. And the laboratory tests that we use to diagnose it are those that will detect the abnormal hemoglobin. That's the compound that carries oxygen in the blood. It's known as hemoglobin electrophoresis.
So at this point, can we avert sickle cell?
Not, we can't. There are some people who can do like prenatal diagnosis so that they know that the child they're getting might have sickle cell or not. And then depending on what their choices are, although most people will go on to have the child with sickle cell because, as you said, they can live a full and productive life.
Let's first start with the fact that sickle cell carriers can have sickle cell children.
Yes.
And at times not. Explain that.
Okay, when you're a carrier, one of the determinants of sickle cell hemoglobin is abnormal and the other one is normal. Because in a child, it takes two of these, one from the mother and one from the father, two genes to make up that sickle cell. So as a carrier, you have one that's normal and one that is for sickle cell. So the carrier will not manifest. But if she marries somebody who's also a carrier, her abnormal sickle cell gene and the abnormal one from the father will come together to make a child who has sickle cell. But if the normal one combines with the normal one from the father, that child will not be having sickle cell. And then half of the children potentially can be carriers as well.
If it is not detected at birth, at what point of a child's life do the symptoms become obvious?
Most will present roughly around 6 months to 2 years. However, we do have some children who present as early as 3 months, and mainly with coughs, colds, and getting infections easily. And there are some people who can go on even to adulthood, teenage or adulthood, before they're detected.
Okay, now to you, Joe, you only got to know you had sickle cell when you were going to Form 1. If you can remember, what brought this conversation up with your mother and how was this broken to you?
I came to know I had sickle cell when I was joining Form 1 because my parents feared that I was going into a new environment because I always wanted to go to a boarding school. So my mom had to explain to me that I had sickle cell. I actually didn't understand what that was until when I started having a lot of pain attacks. Now my mother is not there to take care of me. I'm in school alone. Nobody's understanding. Even the school nurse does not understand. So that's when I started doing research and I knew what sickle cell was.
Do you remember what you were dealing with when you were younger?
I used to have a lot of pain joints, chest, and also my tummy. My lower abdomen used to hurt a lot. Then I used to have recurrent headaches. But I actually did not mind because when I used to ask, my mother used to tell me that I was different. She didn't want me to know what was going on. But I used to carry medicine all over the place.
Professor Jesse, as you mentioned, you can go through life without knowing that you have it. So is it easy to misdiagnose it?
It is, you do need a test to diagnose it, all right, to get the accurate diagnosis. However, how they present, sometimes it's easy to be misdiagnosed because the way they present, especially when they're young, is fairly non-specific. They may present with a pneumonia or a respiratory tract infection and a cold. They may present with pains and fevers which may mimic other diseases. Some have been thought to have a disease known as rheumatoid arthritis that affects the joints because their joints are painful and sometimes the fingers get swollen. Others are thought even to have a cancer like leukemia because they don't have enough blood, so they look pale. So unless you do the specific laboratory test, you may not diagnose it easily.
Now, while still on that conversation, there is a high prevalence of sickle cell in areas that are also high with malaria. What is the connection?
As we were evolving as a human race, people who lived in malarial areas would get sick and die. But one time, a genetic mutation took place in the hemoglobin, And this prevented those people who had that mutation from getting severe malaria. And therefore it was selected out. So the trait, the people who are carriers, are actually somewhat protected from getting severe malaria. And that's why it has continued in the populations, and that's why it's in places where malaria is. But now with migration, people are moving all over the world. We are finding sickle cell where there is no malaria. For example, in the United States, they have about 10,000 sickle cell warriors.
Now, for you, Joe, sickle cell comes with pain episodes known as crisis. Explain to us, help us understand, what exactly do you go through?
My pain usually comes like turn after turn. It feels like somebody is ripping off my skin and inserting broken glass into my veins. It's usually a very painful kind of episode. It might last for minutes, hours, and sometimes weeks. It's usually painful and excruciating.
And how often does it happen?
It can happen anytime, but most oftenly it happens during the wee hours of the night. Most sickle cell warriors complain about having pain episodes or pain attacks at night. And during the day, somebody's active is okay.
Is there something specific you can say normally happens to trigger a crisis?
Yeah, like doing a lot of work without resting, stress, fatigue.
Okay, Professor, when we come back from the break, you'll help us understand what's going on in a sickle cell patient's body to manifest as such a crisis, which sounds very, very intense. But we'll get to the details right after this. Welcome back. Today we're talking about sickle cell, and just before we went to break, Joe Mudukitsa, who is living with sickle cell, was explaining to us the challenges the sickle cell patient has to live with. And Dr. or Professor Jesse, whichever works at this point. Okay, at this point, help us understand what exactly is happening in the body of a sickle cell patient for it to manifest as a crisis, as he explained.
So a crisis is brought about by these abnormal sickle-shaped cells that are there in sickle cell disease. These cells are red cells that are misformed. They look like the sickle shape or a quarter moon. And because of their shape and the abnormality they have, they tend to be rigid and sticky. So that as they're flowing through the blood vessels, especially the smaller vessels, which are known as capillaries, they tend to stick in the capillaries. And when they stick, they prevent blood flow to that rest of that organ or tissue. And therefore, by preventing the blood flow, they cause the pain and the swelling to occur. And these are known as crises. Now, there are several things that can trigger off a crisis. Low temperatures, cold weather, for example. If there is stress, as Joe has said, it can be physical stress, like children running around and doing a lot of exercises, or it can even be emotional, severe emotional stress. Dehydration, like in the heat, when it's warm like this and the children are playing, they forget to take plenty of water. Their blood becomes very thick. Infections, and that's why whenever they get an infection, crises are seen to more occur. And also when the things like pH, that's the pH of the blood, if it falls, and this can happen, like especially patients are going to be going for anesthesia, and during the night when they're sleeping, the pH tends to go lower. And that's why he'll say sometimes they're woken up at night with this pain because the pH has gone lower due to changes in the way they're breathing at night.
A child would not know how much they need to play or not play for them to trigger a crisis. I can only imagine the agony a child has to go through living with sickle cell.
Living with sickle cell is a huge challenge to a normal person, not even just a child, but also a normal person, because you have to limit yourselves from the activities you have to go through the day. You also have to limit yourself within the hours you have to work maybe during a week. And that one is, you know, it's very dangerous if you are working for a company or such, because you need a lot of rest so that to avoid a lot of fatigue, which will trigger a crisis. So it's very challenging to live with sickle cell as a normal person.
Now, you had a blood transfusion at the age of 13, and this is one of the treatment methods recommended for sickle cell patients. What does treatment entail for you?
Treatment for people with sickle cell, it will involve regular blood transfusions. But actually, if you try to manage your diet well, and also try to avoid the things that will trigger a crisis, you can just manage not to go for transfusion, but work with the normal medication that you are given by a doctor. You just have to follow instructions. Sometimes people try to avoid the medicine because maybe there are too many, but sickle cell means that you have to be on medication every day.
What do you recommend to minimize the episodes of crisis and also to avoid instances where you need blood transfusion?
Well, one is the counseling that we do that goes to the mother and also to the patients to tell them what can trigger these crises. Secondly, we advise them about the medications. Some of those medications are to prevent some types of infections. Others are also to prevent frequent crises, and others are like boosters, like a vitamin, to keep them in good health. We avoid blood transfusion unless it's necessary, because the more transfusions you get, there are side effects to blood transfusion, as we know. And in addition, regular follow-up in a clinic, you know, general health check and advice for whatever they might be going through, including psychological counseling.
So apart from medication, Joe, what other ways do you or have you adopted to live with sickle cell?
I like to live positively. I don't want to put the mentality in my head that I have sickle cell and maybe one day I'll pass. A lot of people believe that sickle cell is a death sentence. In the villages, people believe it's a curse or a bad omen. A lot of marriages have been broken because of sickle cell. So me, I just want people with this condition to live a positive life.
Now, Professor Jesse, bone marrow transplant is one of the things floated to actually treat sickle cell. Is it feasible in Kenya?
In order to have a bone marrow transplant, one must have somebody who is compatible with them. That means that the tests done to check for compatibility, and that is between the patient with sickle cell disease and the person who's donating the bone marrow, they have to be compatible. If you don't have that close matching, then there are serious complications that can arise from the bone marrow transplantation. However, where it is successfully carried out, bone marrow transplantation is curative. And so far, it's the only cure that we have available for sickle cell disease.
And can we do that in Kenya?
We are not able to do bone marrow transplantation in Kenya. Yes.
Now, Joe, let's talk about treatment. I mean, I can only imagine with the intricacies of living with sickle cell, there must be a very huge price tag to it.
So managing sickle cell is very expensive. Some people incur bills of up to 20,000 on medications alone. Now, if you are admitted, it will be even much higher, more than 100, 200,000. So sickle cell management comes with a lot of expenses. The medication itself is not free and it's not cheap.
Professor Jesse, NHIF insurance companies, do they take up sickle cell patients?
Not for the normal cover that they have. One needs an extra cover to take care of sickle cell patients in the outpatient, because not every patient needs to be admitted. So it is an expensive condition to have, as Joe says, and NHIF really needs to cover even the outpatient care and not just the inpatient care.
Now, Joe, you are very vocal when it comes to advocating for sickle cell to be taken seriously and to get the support it deserves. So much so you were pushing Parliament at some point to enlist it as a disability. How far did you go with that, and why do you think it should be listed as one?
I petitioned the National Assembly to declare sickle cell a national health priority and to implement something like a medical bill so that sickle cell can be treated for free, can be managed, they can be given free medication and all that. So we went through Parliament with Honorable Isaac Maura. He was still a member of Parliament. So the petition was then forwarded to the Parliamentary Health Committee. We went for one session, so we were told that we discussed a number of issues, but as for now, we don't have any communication as certain that will say it's a relief, because we are still trying.
Professor Jesse, what would be a clarion call to policymakers in as far as this disease is concerned?
The clarion call is that they need to act fast. It's been a long time coming, and I think we need that action now. We've seen quite a lot of action in other diseases, say cancer, for example. We need that same action in sickle cell disease.
Thank you so much for your time. That has been Professor Jesse Githanga, hematologist, and Joe Mudukitsa, sickle cell warrior and an advocate of the same, even as we understood sickle cell disease a little bit more. But clearly from this conversation, a lot more needs to be done in support for those who are living with sickle cell disease, and more resources invested in the same. We now take a look at today's health tip.
In order to be able to sleep, you have to turn off adrenaline. And what's happening these days is if you have a lot of sugar, a lot of caffeine, and you've become digitally addicted, you're checking your Facebook and Instagram, and you can kind of get sucked into a situation where you are always on edge. So if you cannot sleep, don't have caffeine afternoon, don't have a lot of sugar in the evening, do have foods high in magnesium, like pumpkin seeds, and do something that is relaxing in the evening. Maybe read a book, but not a thriller with tons of murders.
Thank you for your comments and suggestions on our social media handles. And it has been Health Diary. My name is Gladys Gashanja, coming to you from the Garden City Residences. See you next time. What happened? Oh, nimeenda haraka sana. Alright. Ni nini? Oh, nimeona kama umenifanya hivi. Sorry, sina specs. Kabisa. It's like my mind and my tongue are not coordinating.